Hi, I'm Bärbel, and I've been living with lung cancer for 8 years. I was diagnosed with advanced lung cancer in stage 4 from the beginning. Because I've never smoked, my doctors didn't look at lung cancer. And when I eventually got the diagnosis, then my health status was already really poor. And I had a prognosis to live just a few more months, well, maximum a year. And well, the situation was really hopeless for me. But that was 8 years ago. I'm still alive and I'm feeling very well. Well, in these 8 years, things have changed fundamentally for patients with advanced lung cancer. Today, it is quite possible for many of us to live for several years, which was unthinkable only a few years ago. And well, I'd like to tell my story to encourage other patients to make use of the chances that arise from the new therapies. My lung cancer experience is very typical. I had many chemotherapies, also a surgery, and repeated relapses. Whenever I stopped treatment, then I had tumor progression a few months later. It were many ups and downs and really a difficult time. Well, I heard very early about a new therapy for patients with a specific genetic defect, which was called EGFR mutation, and I had my tumor cells tested, but it was negative. And then 1 year later, I learned about a similar thing called ALK translocation, and I saw a chart which showed dramatic responses of the first 50 ALK-positive patients who got a substance called crizotinib. And that was a response that was not seen before in connection with lung cancer, and I was really thrilled and excited and got my tumor cells tested, however, negative. So I continued with more chemo and until my doctors gave up and suggested that I might want to try something experimental. So I went for a comprehensive molecular diagnostic to the University of Cologne. In the past, lung cancer was essentially seen as one huge disease. Today it is broken down into many different diseases which are treated differently. It is divided by the driver mutation into genetic subgroups. And what drives success in treatment is whether you know what drives the cancer. So driver mutations are genetic defects that are responsible for the continuous growth of tumor cells, which in some cases can be stopped by specific targeted inhibitors. Unfortunately, these drugs don't work in everybody, so you need to match the right people with the right drugs in the laboratory to nail it down to the proportion of people who really benefit. But for them, these drugs usually work amazingly well. In my case, I was tested on all known mutations at the time until summer 2012, and everything was negative. But then at the ASCO 2012, the world's largest cancer congress, 2 new lung cancer subtypes were reported, which were found in 1% of adenocarcinoma. And I was immediately tested negatively on the first one, but the last one was positive. Since then, I know that I have a so-called ROS1 translocation in my tumor cells. Well, I got this drug, crizotinib, since October 2012. And it changed really everything for me. I virtually got my life back. What was striking was that within 5 days, I felt much better. Within 5 weeks, my tumor symptoms pretty much vanished. It's a sting in the tail. It's not going to last forever. So sooner or later, as far as we know, people will become resistant. But well, the benefit is that at least it takes much longer. The duration of response is much longer compared to a chemotherapy. And many people can stay for several years on such a drug. I've been on my drug now for 3 years. I'm not cured, but so far there is no sign of tumor progression. The advice I would give to others is clearly to get tested. If you have lung cancer and don't know your cancer's mutation, then you should go to your doctor and demand a comprehensive genetic testing. It could change your treatment and your prognosis completely. I would have been long gone if I hadn't got the targeted treatment matching my driver mutation. And at this point in time, well, the best chance that patients with advanced lung cancer have to stay for several years alive is to belong to specific genetic subgroups. And, well, these are called EGFR, ALK, and ROS1, and, well, people should really get tested. It's really, really important.